The knee joint, they have very important supporting ligaments. There are around 10 ligaments will be supporting the knee joint. It's a very powerful joint. We have the medial collateral ligament, which will be here to here, and we have the lateral collateral ligament, and we have at the back will be the arcuate ligament and also popliteal ligament, and anteriorly will be the patellar ligament, in addition to the two menisci, and the anterior and the posterior cruciate ligament, Okay, for the two menisci, we have medial meniscus and lateral meniscus. Those will be cartilage plates which will be located here. So they act like shock absorber. Okay, so those two bones don't crack. So they act as shock absorber, and like the intervertebral disc in our vertebral column. So we have the medial meniscus and lateral meniscus. So this will be the medial side and this will be the lateral side. Okay, so the medial meniscus. Also the lateral meniscus. Okay, you have to differentiate between both. So you can see the medial meniscus. You can see it's a little bit semilunar. Semilunar means like moon shape. Okay, but this one is circular, a little bit circular, semicircular. And you can see that the two ends, the anterior and posterior ends of the medial meniscus, will be containing the anterior and posterior end of the lateral meniscus. The most important will be the difference will be the attachment of the medial collateral ligament to the medial meniscus. So medial collateral ligament, which come from tibia to attach to the tibia, will be fused with the medial meniscus. But the lateral, no, they will be separated. Okay, they will be separated. So medial collateral ligament attached to the medial meniscus. Lateral collateral ligament will be separated from the lateral meniscus. That's why the common injured one will be the medial one. Why? Because it doesn't have free movement. It's not freely mobile as the lateral one. So this one will be very common to injury. Okay. We have also the anterior cruciate ligament, ACL, and we have the posterior cruciate ligament, PCL. ACL and PCL. Okay, so each one will be having origin, insertion, and function. Okay, ACL, always remember that they come out from the tibia first. So ACL means that they come from the anterior intercondylar area here. ACL, anterior intercondylar area, and they go back to be inserted into the lateral condyle. So it means to be inserted here. Okay? ACL. And for the BCL, they come out from the posterior intercondylar area and they inserted into the medial condyle of the femur. So basically, for the ACL, it's going to be stretched during the extension of the knee joint. ACL will be stretched when there is extension of the knee joint. So the function will be prevention of hyperextension. Okay. For the BCL, this one will be stretched during the flexion of the knee joint. Can I say it prevents hyperflexion? You cannot do hyperflexion.
It's flex. Yeah.
So flex. Can you do hyperflexion? Can you do more than this one? Cannot. So it's only stretched during flexion. So what will be the most common for injury? ACL or PCL? ACL. And hyperextension can be valsing. And this one will be very common in football players and basketball players. Okay, once they do the shoot the ball, it's very high power. Sometimes the sometimes hyperextension happen, so there will be injury here. Femoral condyle over the tibia. Posterior sliding. For the posterior, ACL prevent the anterior sliding of the femoral condyle over the tibia. Okay, so to be the opposite, anterior prevent posterior sliding, posterior prevent anterior sliding.
I see.
So also it has an important role, as you mentioned, in prevention of the dislocation. Okay.
Shamo, you're not trying to think about what I'm saying.
We have here the femoral condyles over the tibia. So looking means you have to fix something. Will be medial rotation of the femoral condyles over the tibial condyles. That's why I said you have to fix one, so not to get confused. But the unlocking will be the opposite. Will be lateral rotation of the femoral condyle over the tibial condyle. Okay.
Locking, unlocking. Locking medial, unlock
But
lateral.
then it will be opposite for tibia.
Dia moving.
Tibia will not be moving.
The way we describe tibia is fixed. The one move.
The
But if
femur.
femur is fixed, tibia is moving, that's opposite.
Opposite, yeah, obviously it will be the opposite.
So the question can ask like that actually. Whether it's
Actually, we had this MCQ.
Yeah,
last
it's in
time.
the
Last time there
I
was.
was like,
Tibia right. I can say same in the looking. It will be the lateral rotation of the tibia.
Tibia or the femur.
yeah,
So
exactly.
that's why you have to fix something to memorize. And once the question comes, you write down and then you see it's correct or not. So it will be the opposite by the unlocking. So what's the looking and what's the unlocking? Basically, this one is a physiological action. Okay, now I'm standing now. Okay, so because the knee joint is very flexible, so I can be doing like this or moving here or moving here. So I need to stabilize. So it will be working like a lock to prevent the movement once I'm standing. So for the locking part, this one we call the last stage of extension. Last stage of extension. Okay, what does it mean? Mean that I'm walking now, okay? I'm walking, so no problem. I'm starting to stand, okay? I will stop. So I will be doing the extension, but the extension here will be complete, okay? So once I do the extension, I want to stabilize, so I will be doing the locking to stop. Okay, so it will be the last stage of extension by medial rotation of the femoral condyle on the tibia. So we'll be doing like this, lock, okay?
Locked.
Yeah.
Alright, so this one will be done by vastus medialis in the knee.
Vastus medialis.
And
This question is.
could be also aided by all of the quadriceps, vastus lateralis, intermediate, and rectus femoris.
Yeah,
But mainly vastus medialis. Let's see the opposite one will be the unlocking. Now I'm standing and I want to move. Okay, so the lock is there. I cannot move while the lock is there. I have to unlock.
Unlock.
So what I'm going to do, I'm going to do the lateral rotation of femoral condyles over the tibia, and this one will be the early stage of flexion.
First stage, early stage.
Yeah, because I'm going to move.
First stage of walking.
So I want to move now. So what the first thing to do to move? I have to flex my knee. So the first thing to do is unlock.
Unlock.
So I do unlock and then start to do that flexion part and start to move.
By the vastus lateralis.
by
Popliteus.
Yes.
obliques, it's all muscle.
Yes.
Take care, not vastus lateralis.
Oh,
Popliteus.
the below one.
Okay?
Unlocking done by popliteus.